Hello, my name is Michael Lichtenberg from Arnsberg Vascular Center. Today I would like to introduce you to the MIMIC 3D 2-year results. These results were recently presented at LINC 2021. The BioMimic 3D stent is a stent which promotes swelling flow. You could see that the stent has a unique shaping with a helical center line, as you could see on the left side. This imparts non-planar curvature to stented femoral palpate segment, improved by mechanical performance compared to straight stents is obvious. The stent promotes swelling flow. Swelling flow increases wall shear stress on endothelial cells. We know that wall shear stress naturally protects against atherosclerosis and intimal thickening. Increased wall shear stress has been shown in many publications to provide an anti-proliferative effect after stenting, without the need for a drug. You see the difference between the straight stent and the BioMimic 3D stent in terms of flow. The BioMimic 3D stent also improves the biomechanics of a stented artery. See the difference between a BioMimic 3D stent on the left side versus a straight stent on the right side. It's this CT angiography. Of course, such a unique stent needs a very intensive clinical program. So far, more than 1,700 plus patients are included in many trials. Today, I would like to highlight some of these trials. One of the most important trials was the MIMIC's randomized control trial. This trial proved the concept of a swelling flow and showed that the BioMimic 3D stent has a unique favor in terms of freedom from CDTLR over a straight nitinol stent. Have a look at the difference between the freedom from CDTLR between a BioMimic 3D stent and a straight nitinol stent. The 24-month primary patency for the BioMimic 3D stent was 72%. For a straight nitinol stent, 55%. Freedom from CDTLR after 24 months, 91% versus 76% for a straight nitinol stent. Followed this very positive data, the BioMimic 2 IDE study was initiated. The PIs were Timothy Sutherland from the United States, Thomas Zeller from Europe, and Dr. Nakamura from Japan. 43 investigational sites included 271 patients. Of course, the data were adjudicated with an independent core lab, duplex ultrasound, angiography, and follow-up X-ray were analyzed. You can see on the right side the Kaplan-Meier survival estimates of freedom from clinical driven TLR 3 months, which was reported with 81%. The 12 months primary patency rate was reported with 73.1%. I would like to highlight today also on the MIMIC 3D registry data. Within 43 investigational sites, 507 patients were included in this prospective registry. This was conducted as an all-comers registry, trying to involve as many patients from a daily routine practice in such a registry. The patients will be followed up for 3 years. Today, I would like to introduce you to the 2-year outcome data. You could see that the technical success was very high within this registry, 99%. The procedure success, 98%. You see the baseline patient demographics. Typical patients with Rutherford 2, 3, 4, but also many claudicants were included in this trial. You could see that 24% of the patients had critical limb ischemia, and a lot of diabetes patients were included. You see the baseline lesion characteristics. Very challenging lesions were included in this registry. You could see that in nearly 57% of the enrolled populations with 580 lesions, an occlusion was present. The lesion length 127 millimeter, and this I personally believe reflects very well an all-comers registry. Also, high-grade calcification lesions were included in this registry, as you could see here, grade 4 in close to 40% of the cases. So that means that 38% of lesions had at least moderate to severe calcification. You see the baseline procedural data. The stented segment length 130.8 millimeter. The technical success, as already mentioned, 99%. Very interesting to see that 50% of the lesions were treated with a biomimics 3D and drug-coated balloon. So in summary, in terms of that lesion analysis, we included more complex lesions. You could see that easily when you compare the Mimics 3D lesion data with the Mimics RCT and Mimics 2 which are presented. We also included very sick patients. Interestingly, the biomimics 3D stent was in 50% combined with the drug-coated balloon angioplasty. So I personally believe this registry represents our daily routine practice. So we have very valid data for analysis. You see the freedom from loss of primary stent patency over time. After 1 year, 88%. After 2 years, 76%. I personally believe this very challenging population with these very challenging lesions showed a very good primary stent patency with 76% after 2 years. You see the freedom from clinical driven target lesion revascularization. After 1 year, 92%. After 2 years, 84%. Again, a very good outcome for this very challenging patient population. You see the freedom from clinical driven TLR 2 years, the drug-coated balloon versus non-drug-coated balloon group. Remember, I told you that 50% of the lesions were treated with DCB plus stent. You could see that the drug-coated balloon did not have any impact in terms of freedom from clinical driven TLR over time. A very interesting outcome. So there's no statistical difference between DCB and non-DCB patients. The addition of paclitaxel by use of a DCB adds therefore no benefit to clinical outcome in this study. When you compare the biomimics 3D registry data, outcome data, to other already reported registry and study outcome data, you can see that especially for the very challenging patient population, for the Mimics 3D study, that there was no difference even with this very challenging population and this very challenging lesion situation to other trials. So there's a comparable outcome to drug-eluting stents and Supera stents despite more challenging lesions and without the need for lesion preparation. Therefore, I would like to summarize even that we included more challenging patients in this registry with 24% critical limb ischemia, with longer and more complex lesions. Kaplan-Meier freedom from loss of primary stent patency of 2 years was very impressive with 76%. That also meant for the patient a very positive outcome in terms of clinical driven TLR 2 years with freedom from this endpoint of 84%. There was no statistical difference in CDTLR between DCB and no DCB cohorts. Therefore, the statement is clear. The addition of paclitaxel adds no benefit to the clinical outcome. Comparable outcome of drug-eluting stents in Supera, despite more challenging lesions and without the need for lesion preparation. Therefore, this prospective registry proves the therapeutic value of swelling flow. Summary, the biomimics 3D vascular stent system reduces the burden of reintervention for the patient and the healthcare system. Thank you very much.